P.
Well, what letter's that?
F.
That's an F, and how's an F start?
Last October, Mark Spindell, a 59-year-old elementary school principal from New Jersey, had a biopsy that showed cancer in his prostate gland.
When I was first told that I did have cancer, my heart fell down to my feet. I became very uncertain as to how advanced it was. Will I be a survivor?
Prostate cancer is an extremely complicated area of medicine. Increasingly, experts are questioning whether it is being properly treated. Indeed, a diagnosis of prostate cancer can be confusing because there are so many treatment options. The three main forms widely available for prostate cancer patients are active surveillance, radiation therapy, and surgery.
You hear of other people having prostate cancer, but you don't think that it could ever happen to you. And now you really have to reach out and find the necessary elements of what you're going to do next.
Treatment options vary based on the stage and grade of the cancer. Mark's tumor was discovered early. It had not spread outside the prostate gland. He chose a robotic-assisted radical prostatectomy. His doctor is Ash Tawari at Cornell Medical Center, New York Presbyterian Hospital.
I understand what you're going through, and it's not easy.
The tests show that it is self-contained.
That's right. It's an early cancer.
Is it actually that is my main concern. The factor that there will be incontinence and impotence is on the back burner, but that is also a concern of mine. And when will that come back to me?
Once we get all the cancer out, the next priority is on the urine control. And that makes a difference because that will have an impact on your quality of life. Patients differ in terms of their sexual function before surgery. Patients differ in terms of what kind of a tumor they have. Patients also differ in terms of their age. Patients differ what kind of a medication they are taking, and patients differ in terms of their body weight and the prostate size. These all things can ultimately impact what kind of impossibilities for a recovery of sexual function they have. Okay?
Yep.
Thank you very much, Doctor.
Take care. And
7 days after his pre-operative meeting with Dr. Tawari, Mark and his family arrived for their early morning surgery.
anything specific in your mind?
No, I'm just worried about the outcome, that it is self-contained.
I'm a little bit nervous about the next couple of days. You know, he needs a little bit of TLC and some care, but I understand it's fairly easy, and we'll get through it.
Before we embark upon doing a robotic, we have to have a very clear-cut plan as to what we want to do. We use a specialized biopsy information to kind of create a map. This MRI scan is also available in real time so that we can cross-refer while we are doing the surgery that where exactly the tumor is, if it is visible.
During surgery, Dr. Tawari sits at a master operating console and uses 2 finger-controlled joysticks to manipulate a camera and surgical instruments attached to a patient-side robotic cart. Removing the cancerous prostate gland is the #1 goal of the surgery. Dr. Tawari must also be careful not to damage the muscles and nerves involved in urinary and erectile functions.
Instead of touching the nerves, we kind of delicately tease prostate away from those nerves. We were always very conscious that to look for any telltale signs of cancer trying to come to the surface, and which was not in his case. There was an area on the left side. I was a little concerned. It was showing a significant bulge, and that is the area where actually his cancer was. But I think we stayed in a decent, safe plane around that area.
Within 24 hours after the surgery, Mark is out of his bed and walking in the recovery area.
How much have you walked today?
Walked probably about 3/4 of a mile.
That's impressive.
I'm just waiting for the test results to come back, which I'm anxious about. Other than that, I feel fine. Fine enough to go home right now.
Dr. Tawari discharges Mark from the hospital later that morning. They meet again 7 days later when Mark returns to the Brady Urologic Center to get his catheter removed and to receive news of his pathology report.
Let me just kind of give you all the details. It looks like you have negative margins, negative lymph nodes, negative seminal vesicles, and bottom line, negative here is good. So it's everything is gone. Had cancer on the side where I was seeing that bulge, but it looks like that the margins are negative, so that's really important. This is the best pathology report we can get, but that's the moment of truth. Every time I look at the pathology report, I'm nervous, and patient is nervous.
6 weeks after surgery, Mark is walking 3 miles a day with his wife Jane at a local community center. Walking is an important aspect in the recovery of prostate cancer surgery, as it helps patients to regain urinary continence by strengthening the muscles of the pelvic floor. At home, Mark is getting back into the routine of things and is eagerly looking forward to returning to work. Still, he must avoid heavy lifting, which could lead to a hernia at the incision sites as they heal.
I have no problems with incontinence whatsoever. During the first week, the problem was basically corrected, and I'm very lucky to say so. The other aspect with the sexual functions, I'm getting right back on track with that, and basically on average where everybody should be at this time. The biggest surprise probably was the need for another individual to really take care of you, especially for that first week. The emptying of the catheter bag, the sleepless nights because of sleeping on one's back, the difficulty in walking.
Well, I think in some ways it's made us closer. You know, we spent a lot of time working things out and trying to help him feel better, and you know, but I think it's time he's gotten back to work.
There's a cliche that live each day the most because you never know what tomorrow brings, and I guess I've started to do that because you never know what tomorrow will bring.